Good morning. As of yesterday, the city has 9,650 reported cases, 132 people hospitalized with COVID-19, and 366 deaths. I'm up here every week to ensure our residents have the most up-to-date and accurate information, so in turn they can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resource and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptoms, screening, and to be connected to a physician for assessment. I also want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. I've always said that we would continue to monitor the data and not hesitate to tighten restrictions if the data tell us it's needed. Today, after careful review of Baltimore City's COVID-19 health data, I will be signing an executive order that will halt indoor dining for restaurants and bars, and reverting back to outdoor dining and carry out for delivery only, with patrons and staff maintaining social distancing and wearing face covering outdoors. Patrons may remove face covering while seated and eating or drinking. Additionally, the health commissioner is enacting a health order that will require the wearing of face coverings by everyone over the age of 2 while in public places. This is an extension of the governor's current order to wear face covering in certain businesses. All of these changes will go into effect effective Friday, July the 24th at 5 p.m. I'll read that again. All these changes will go into effect on Friday, July the 24th at 5 p.m. These new restrictions will remain in place pending improvement in the data based on regular evaluation by our health department of case count, case deaths, ICU and acute care hospital bed utilization, case positivity rates, and the number of tests performed, to inform decisions around when these activities can safely resume. Again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. And as always, we continue to monitor the data daily. Now we ask Baltimore City's Health Commissioner, Letitia DeRosa, to update you on our COVID response and how we examine the data to arrive to today's action.
Good morning. Thank you, Mayor Young, for your leadership during such difficult times. As Mayor Young mentioned, effective Friday, July 24th at 5 p.m., I will be issuing a health order requiring face coverings be worn by all residents over the age of 2 whenever they leave the house. This is an expansion of the current statewide mask order, which requires face coverings be worn in certain locations, such as public transportation, in restaurants, and in retail establishments. Additionally, beginning Friday, per Mayor Young's executive order, Baltimore City bars and restaurants will no longer be able to seat or serve customers indoors. While outdoor dining continues, socially distanced seating remains a requirement. These decisions were not easy, nor were they made to punish a particular industry. Instead, these decisions are rooted in current data and trends being seen in COVID-19 cases in Baltimore City, as well as information about the transmission of the novel coronavirus. When considered together, this information warrants the implementation of restrictions to help halt the further spread of COVID-19. I would like to point out 4 data trends that we have identified as problematic, therefore requiring more direct intervention in the form of restrictions. As a reminder, much of this information is available on our dashboard at coronavirus.baltimorecity.gov. Baltimore City, through hard work by our clinical staff at the health department, along with our partners at local hospitals, clinics, and pharmacies, continue to increase local testing capacity, and we are now averaging over 2,000 tests daily. However, we are seeing the number of new cases increase at a rate higher than we would expect from an increase in testing capacity alone, and have seen an increase for multiple days in a row. While our fatalities have not dramatically increased, they have not decreased either. Deaths as a result of COVID-19 are usually a lagging indicator of a spike in new cases, and it might not increase until weeks after the spike of positive cases have been identified. A little over 1 month ago, the city passed into phase 2 of its reopening plan. And in 1 month's time, along with our epidemiologists and data team, I have consistently analyzed and reviewed the data on a daily basis. I've also presented regular updates to the mayor and his executive team. 2 weeks after reopening on July 4th, our average daily case count in Baltimore was 63.4 cases per day. A week later, on July 12th, that average had risen to 109 cases per day. And as of July 19th, with just preliminary data, our average daily case count is 134, and we still have pending results. This indicates a doubling in just a month's time. We have also seen a different profile of the average coronavirus patient emerge in the past few weeks. In the early days of the pandemic, our case data demonstrated that older adults, residents of congregate settings, and those with pre-existing conditions made a larger proportion of cases. However, in the past week, we have seen the median age of new coronavirus cases drop to 35 years old. Both the highest incidence rates of new cases and the highest test positivity rates are now in residents between 20 to 40 years old. Finally, our daily positivity rate weekly average on July 4th was 5.3%. However, from July 5th to July 12th, it increased to 6.8%. And this average also continues to increase. Certain zip codes, specifically the 21224 zip code, which houses neighborhoods like Canton, Highlandtown, and Patterson Park, have seen positivity rates as high as 22%. In summary, since we reopened to phase 2, Baltimore City has seen an increase in cases, double what we were seeing prior to reopening, a dramatic rise of cases in our residents under the age of 40, and a disproportionately high positivity rate in the southeast part of the city. We anticipated that reopening would come with an increase in cases, but all the data trends combined raises our level of concern and requires a reevaluation of the openings allowed under phase 2. The decision to suspend indoor dining at bars and restaurants is not one that was made lightly. We took into account several indicators, including the number of bars and restaurants with indoor dining that have had temporary cease operations due to positive cases. We've also looked at data at other countries and cities. They've reported stories of asymptomatic super spreaders attending bars who later were found to have infected dozens of other people in the course of a single evening. Tight enclosed spaces with poor ventilation may allow the coronavirus to stay suspended in the air for hours at a time, creating opportunities for disease transmission beyond close proximity to an infected person, which is exacerbated if social distancing is not being practiced. Out of an abundance of caution, we are moving to outdoor dining only for Baltimore City, in line with the Center for Disease Control's risk assessment for dining during the coronavirus pandemic. Social distancing continues to be the most effective method of reducing the chances of disease transmission, with the wearing of masks when social distancing isn't possible serving as a vital additional layer of protection. As a reminder, you right now could possibly be infected with coronavirus and not have any symptoms. If you are still choosing not to wear face cloth covering, you are directly endangering the lives of your friends, your family, your coworkers, or others who you may come across while out. My health order, which takes effect on Friday, now requires all residents to wear a face covering when in public, the sole exceptions being for children under the age of 2 or those with underlying health conditions that make wearing a mask dangerous to one's health. Baltimore, if you're outside your house, please wear a face covering. I recognize it's hot outside, and you may think it's too hot for face coverings. My recommendation, bring several face coverings with you when you go out so that you can replace them if you perspire. The Centers for Disease Control and Prevention recently cited the benefits of wearing a mask to protect yourself and others, to flatten the curve and slow the spread of COVID-19. We are in this pandemic for the foreseeable future, and we will have to make tough decisions to protect our community and our most vulnerable. We remain committed to transparency and open dialogue about how we can move forward. As your health commissioner, I thank everyone who has abided by our social distancing and face covering guidance so far. Today's decisions have been made to reduce the chances of further disease transmission, but it remains necessary for us all to stay vigilant to protect ourselves and our loved ones. Thank you.
Thank you, Dr. Zavasa. And again, these restrictions are being reinstated to protect the health and well-being of Baltimore City residents. Thank you and have a safe day.